All right. Hello, everyone, and thank you for joining the Bay Path University Healthcare Administration On-Demand Info Session. My name is John White. I'm the Assistant Director of Graduate Admissions, and I cover this healthcare administration program. And I will be joined by our Program Director, Dr. Anna Zandel, shortly. But we're excited to share with you some general information about the program, student services that we have for graduate students, as well as the admissions process. And we will also be going over some frequently asked questions at the end of this, so please stay tuned for that as well. So just to kind of give you a little bit of some general information of Bay Path, here's Bay Path at a glance. Bay Path University was established in 1897, and since then it has been preparing students to be successful in an ever-changing world. We do have three campuses. We have campus in Longmeadow, Massachusetts. We have one in East Longmeadow, Massachusetts, as well as a large online presence. We currently have nearly 5,000 students across these three campuses, and we have over 17,000 alumni worldwide. And we are an accredited institution by the New England Commission of Higher Education. And so we here at Bay Path understand that there are many options available for students in the current world. So really kind of, why choose Bay Path? First off, we are flexible and accessible for students. We have online, hybrid, and on-campus programs, so there will be a program for you. Many of our online graduate students, they work full time, they take care of families and have other responsibilities. So it just kind of shows that our programs are flexible to fit in to everyday lives of people. Next, we do have a supportive faculty and staff. We will be with you every step of the way, from the admissions process to registration to academic advising. There will always be a staff member there to kind of guide you through that. Third, we have an engaging and diverse community of learners from many backgrounds. This will allow you to work alongside students kind of from all walks of life, which is really interesting. And then finally, we have an innovative approach to learning. Our curriculum uses technology, active learning strategies, and is often project-based, focusing on real-world experiences, allowing for students to be kind of be able to immediately apply their knowledge once they get into the workforce, which I think is really interesting. So that's just kind of some general information about Bay Path University. And with that, I would like to introduce our program director, Dr. Anna Zendel, who's going to be going over some information about the program itself.
Great. Thanks so much, John. And hello, everybody, and welcome to this info session. So let's start out with talking a little bit about, healthcare today. We know that healthcare today, it's highly complex, it's changing rapidly, and we've been in a state of disruption for quite some time now. It's been greatly exacerbated by, our pandemic recovery and all the socioeconomic and political stressors that have been impacting on healthcare. And we're seeing a lot of disruptions within our workforce. We're seeing supply chain disruptions. We're also seeing an aging workforce along with an aging population with, different needs, emerging needs. We have cybersecurity challenges coming, and we have all these rapid technological advancements with the opportunities and the challenges that come along with them. And then, when we think about research, the research, especially with AI now, really a support tool for a lot of the research. It's offering us a lot of opportunities for interventions, clinical interventions, administrative interventions, community interventions that can address just a myriad of healthcare concerns as well. Healthcare systems, they are increasingly integrated. This has been a major systems change over the past several decades, and it offers a lot of opportunities for healthcare administrators to make a difference in healthcare quality and access to healthcare for all. It's a field ripe with opportunities to make a difference. The Bureau of Labor Statistics, the BLS, notes healthcare, including healthcare management, as one of the fastest growing occupation groups. And this is due to expansion and diversification of the industry, as well as, the growing technology influence as well, and those career needs. So the field is really looking and needs multidimensional leaders who can address these challenges and leverage the many opportunities that come with that. And we really equip our students to be those leaders. So you're looking at the BLS data, you can see, just really quickly that the median salary for medical and health services managers is just over $101,000, $101,000. And again, looking at the salary for some of the common health administration work areas, you can see that the most common employers and the highest paid tend to be in general medical and surgical hospitals, and physicians' offices. Although, there's a wide world in healthcare administration even beyond those that do pay well. If you'd like to drill down to look at some of the other areas, the other work areas, if you have a career interest, you can visit the BLS web link at the bottom of the slide, or you can always reach out to us as well, and we can help you to explore options. So let's take a look at some employment opportunities. Excuse me. There are, as you can see on this slide, there are a lot of career opportunities for healthcare administrators, and these are just a few of the popular openings. There are opportunities in so many settings, from hospitals and healthcare city systems to clinics and community settings. I'm seeing just a lot of growth in quality assurance, in pharmaceuticals, healthcare insurance, and with government agencies as well. I'm seeing an increase in healthcare leaders also entering into consulting or other entrepreneurial careers. And a lot of these folks are people who've been working in clinical systems, and are just looking to leverage that experience and that expertise to guide organizations and to be their own bosses as well. The growth of AI is a huge piece of the employment pie as well over the past year, with it being increasingly embedded into a lot of these particular employment opportunities, but also, AI directors, AI consulting, and just that growing understanding of AI. Some organizations call it AI literacy, AI fluency, but just an understanding of how AI works as I like to call it, as a power tool in healthcare. And this is increasingly tied to the administrative role, being able to lead those initiatives. So now that we've talked about some of the opportunities in healthcare administration, let's talk about BayPath's Masters in Healthcare Administration, or the MHA program. Excuse me, allergies. So this is a 36 credit program with 24 core course credits, and those focus on, those foundational need areas for all healthcare administrators, for all leaders. And then there's a selection of 12 credit concentrations or 4 courses that will let you develop an expertise in an area of healthcare leadership. And I'll share more about that in just a moment. So we're 100% online and asynchronous. And this means that you can study and earn your degree fully online. So while there are deadlines to meet each week, you don't have to be signed into the course at specific times during the week, unless you choose to attend, say a scheduled faculty office hours event or something like that. The asynchronous nature gives you a lot of flexibility, and we want you to have that because we want to support you in balancing your work, family, and all the other life roles that you have as you earn your master's degree. Our program typically takes about 2 years to complete, but we also now have an accelerated option that lets you complete the program in 12 to 15 months. Looking at our courses, they're designed to give you the knowledge and the skills to succeed and to excel in your career. We work closely with healthcare leaders to design our courses, and we have an outstanding and just very talented and caring faculty who are experts in their healthcare fields and in leadership. And they'll guide you in your learning throughout each course. Along the way, you'll also have the opportunity to earn certificates and other credentials. We operate by a cohort model, which is really nice because you get to go through the program with a group of students who start at the same time as you. You'll have the opportunity to learn from students in other healthcare fields, that diverse population, as John just mentioned. fields like public health, the business side of healthcare, nursing, occupational therapy, and other fields as well. Um, this is an important part of our program as we know that healthcare is increasingly interprofessional and organizational leaders need to have that ability to collaborate across healthcare professions, across organizations, across fields entirely. And we really want you to be ready for high impact interprofessional collaborations. So let's take a look at the program foundation. So, the foundation of our program consists of healthcare systems, ethical leadership, quality and safety, healthcare finance, and some budgeting, organizational behavior and development, strategic planning, law, policy. Again, ethics. Ethics is, we have a specific course for ethics, and it's also infused throughout our curricula. Um, and these are core knowledge and skill sets wherever you want to go in your healthcare administration career. You definitely need to have these. We also have several concentrations and certificates for you to choose from. So we'll start out with organizational excellence, which is a very popular one. And this focuses on improving and also innovating in healthcare. If you choose this concentration, you'll earn two graduate certificates, the organizational excellence grad certificate, and then you'll also earn your Lean Six Sigma Green Belt, which is really highly prized in healthcare leadership and in administration because it gives you a lot of the skills to solve quality, safety, efficiency, and other sort of perennial issues that organizations face. Then we have health informatics, which is another popular one. And this focus on electronic health information systems, the EHRs, electronic health records, but also other electronic and data-driven systems. Think about how smart technology and AI-driven tools have become such an integral part of healthcare. We cover this, and we prepare you to make decisions, to be able to make decisions and to guide teams and to know what questions to ask to make the best decisions. True to our career advancement focus, this concentration and certificate makes you eligible to join the Healthcare Information and Management Systems Society, commonly known as HIMSS, so that you can take a certifying exam to become a certified professional. Then we have public health. And this certificate prepares you to be a leader in the public health sector. It's an opportunity to make a difference in community and population health sectors, to be change agents around emergency preparedness and response, issues like climate change, disease and outbreak surveillance and management, and many other areas. The pandemic and these other currently occurring infectious disease outbreaks have taught us that public health is a vital part of the healthcare system and that it needs to interface deeply with, sort of the medical infrastructure. And we also know that the next generation of public health leaders is very badly needed right now. So next we have business, and business is a concentration without a graduate certificate. This is great if you're interested in the business side of healthcare. You can choose from a variety of business courses that can prepare you to, work in sort of the accounting side, deeper in the financial side of things, deeper in analytics as well. And if you're interested in starting your own consulting or other business, this might be a great fit for you. We have a number of students who are really interested in setting up health coaching businesses and consulting, and they've they've just grown so much with this particular concentration. Next, we have quality and safety management, and this graduate certificate prepares you for a career in quality assurance, quality improvement, risk management. And here you really learn how to leverage data and manage projects that lead to real improvements in patient care and in organizational performance as well. And you'll be eligible to sit for several national credentialing exams as well if you go with this particular certificate. And last but not least, we have our clinical and organizational ethics certificate. And this is kind of a niched area. This is for those leaders who want to have a career focusing in ethics, so to be an ethicist. And we're really seeing this increasing need for expertise in ethics around AI and other technologies that are growing a lot faster than our regulations and laws can keep up with. So we have a lot to choose from, and we keep growing as well. So if you're interested, stay tuned. More to come. So let's look at what your degree plan would look like. So I mentioned that we have a 2 year and then a 1 year track. So for 2 years, if you want to take sort of our regular 2 year sequence, we run 3 semesters per academic year. And each semester has 2 8-week sessions. So session one and session two. On our typical 2 year schedule, you would take one course per 8-week session so that you can focus on just that one course. It's really manageable for a lot of students who are balancing, parenting, work, and just a lot of other stuff in their life. And what you see here on screen is just a snapshot of what your degree plan could look like. The plans are going to vary, the courses will vary depending on which certificate or concentration you choose. And we'd walk you through a degree plan that meets your career goals as well. And the way this works is, you and I would meet after you enroll for an initial advising session. And we would set up this plan for your whole 2 years. And then you can just kind of go through the program without the stress of trying to figure out what courses you need to take each semester. We really try to make it as easy as possible for you. Then we have the 1 year accelerated, and this is a snapshot on screen of what the 1 year could look like. In this case, you would be taking 3 to 4 courses per semester. Um, we typically start out the very first 8-week session with just one course to have you get acclimated to the rigors, the intensity of the graduate learning environment. And then we would increase to two per session. So you'd be done in 12 to 15 months. And again, the exact courses that you would take would vary upon when you come into the program, fall, spring, or summer, and then which concentration or certificate you choose. And we have a lot of other learning opportunities at BayPath as well. We want your experience with us to be meaningful for your career and your goals. And there can be so much more beyond the coursework. So we offer all of our students an ACHE Associate Student Membership. ACHE is the American College of Healthcare Executives, which is the major leadership professional association in the United States. We have chapters in most states, and being located in Massachusetts, I tend to focus a little more on the Massachusetts chapter. But with this, whatever state you're in, you would have access, excuse me, to ACHE for networking, mentoring, professional development, scholarships. There are job search boards with ACHE. And so the way that this works is, you'd get settled into BayPath, into the program, and we would activate your membership, your paid membership, at the end of your first semester. Then we have the UPD Honor Society, which stands for Upsilon Phi Delta, and that is the premier global honor society for healthcare leaders. Students who meet eligibility criteria of 18 credits into the program and a 3.5 GPA are invited to join. And like ACHE, our UPD chapter offers networking, mentoring, professional development scholarships, career growth supports, and a supportive community during your master's and throughout your career. Our chapter is relatively new, but we're growing very intentionally so that we at BayPath, can provide that supportive, nurturing environment as your early career leadership, mid-career, and even into later career, mature career. We also have a graduate student association, which is a phenomenal way have to have input into decision making on graduate studies across Bay Path University. We in the School of Health and Natural Sciences, where this program is located, we do interprofessional gatherings, learning opportunities, and networking as well. So all of our programs, so healthcare administration, occupational therapy, physical therapy, physician's assistant, public health, all of our programs will come together once a semester or so and talk about a pressing issue that all of our professions face, and how can we come together across these disciplines to make a difference and to make change. And then we also have internship opportunities. And if you're interested in internship opportunity, we could talk about that. So why are MHA? I've kind of thrown a lot of information at you so far about the program. And so here's kind of the bottom line. We're really dedicated, my team, our faculty, we're dedicated to giving you the tools to be a healthcare leader that really can address some of these pressing issues that are facing healthcare today and in the years to come. We model our curriculum after national standards, and we're constantly reviewing our curriculum to be sure, that it's robust and that it's meeting today's needs and what we know of tomorrow's needs as well. We have a strong interprofessional team approach. Our graduates are able to function effectively on interprofessional teams as both leaders and collaborators. And in looking at the job postings, which I'm looking at job postings at least every quarter, this interprofessional skill is consistently in the top 5 sought after job skills in healthcare organizations. So it's pretty important. And there are a lot of opportunities for career advancement and so many networking opportunities here as well. And I share, even beyond the network opportunities that we've shared in this info session, I also share others as they come about. We equip leaders who can lead, implement, and sustain positive changes in their organizations and professions, and who can also, help to mitigate some of the stressors and the challenges and the tensions that healthcare organizations are facing on a day-to-day basis. And leaders who can meet the needs of individuals, families, and communities, which is also really important. So now I'm going to turn things over to John, who's going to talk more about what to expect when joining the Bay Path Learning community.
Thank you so much for all that information, Dr. Zendel. So yeah, just kind of going back to the Bay Path community side. We just want to talk about graduate student support. Something that I really love at Bay Path is that all of our student support systems students are still eligible for, despite being a graduate student and fully online. So I'll just kind of go through all the services that you'll have access to. Starting with graduate admissions, that's me. If you haven't already worked with us, you most definitely will. We're kind of there alongside you to assist you through the admissions process, and we kind of work with you from before you submit your application all the way right through before you start your first semester. So we'll kind of be there all through that admissions process. There's also career services for students, and this is something that, like I said, you'll have access to even as an online graduate student. Things like resume writing, interview prep, and job search assistance. This career service team will be here to assist you with that. We also have accessibility services for students that may need any accommodations. We do have the student financial service team. They're here to help you kind of deal with financing graduate school and kind of how to go about that, as well as assist you with the FAFSA application. So we'll talk a little bit more about them in a few slides from now. Then the Hatch Learning Commons. This is our physical and virtual library here at Bay Path University. Online students have access to both the physical and the virtual space, and we do have an online database with a ton of materials that you're able to access virtually. So that's a really great service as well. And you have access to the registrar's office, and we also have online learning support as well as tech support to kind of help out with students that may need assistance online. Oops. And then, so like I was saying with the online, kind of with the online aspect, we do use Canvas here at Bay Path University, which is one of the most intuitive online learning platforms available. Whether you've used it before or you are new to the platform, all new students do have access to a free online course to help orient students. So this will be called EXT 099. It'll just kind of help you get used to using Canvas and kind of orient you to the system. And my personal favorite thing about Canvas is just how flexible it is. It's accessible from desktop, tablet, or your mobile device. So whether you want to be in bed on your phone checking Canvas or at your desk on your computer, you can totally do that. So it's really great for that flexibility. And it does have telecommunication as well as video capabilities for students using it in the system here. And then, as I mentioned before, we do have that dedicated online support team if you have any questions about how to go about accessing or your courses or using Canvas. And as I mentioned before as well, our student financial services team, they are great. They're here to support students, and every single student will have a SFS advisor based on your last name. So they're just kind of here to help you work through financing graduate school, especially with the FAFSA application, as I know that they never make that easy. So I always recommend students reach out to them, and they have some really great services. They do have things like FAFSA Fridays where you can get live help filling out the FAFSA application. As I'd mentioned, I know it's not easy, so having that live help to help you out filling out that application is really great. We also have Financial Aid TV or FATV. This is a great source for students that where they have short form content on under a minute where you can just watch a quick video that usually can answer your question or show you some how-tos regarding financing graduate school. And then finally, Stafford loans are available for students. Most students qualify for up to 20,500 per year or up to 100,000 for the entire degree. So like I said, I always recommend reaching out to Student Financial Services via phone, email, or in person, and they'll definitely be able to help you out with the with financing graduate school. And so moving forward, the requirements for the healthcare administration program, as Dr. Zendel had mentioned earlier, we do have 6 start dates throughout the year. So we do have 2 in the spring, 2 in the summer, and 2 in the fall. And we do operate on rolling admissions. So once you submit your application and all the supporting documents, the sooner we get that, the sooner we will review your application for your desired start date and get a decision back to you. Although we require besides the application and supporting materials, is just a bachelor's degree from an accredited college or university. We do have a preference of a GPA of 3.0 or higher, but we do take a holistic approach into reviewing applications, so don't let a lower GPA than 3.0 deter you from applying. So our application is free. It's on the Bay Path University website, and it only takes a few minutes to complete. Once you submit an application, an admissions counselor, most likely myself, will be in contact with you kind of about the next steps. So we do require a completed application file. So we do just ask that all official college/university transcripts are sent directly to Bay Path University Graduate Admissions Office. So we'll just need those. Then a statement of purpose, 250 to 500 words, just sharing your reasons for applying to the Master's in Healthcare Administration program. And in this statement, please just tell us about the experiences that drew you to the Healthcare Administration program, the specific skills or knowledge you hope to gain in this program, and your vision for your professional future. And then finally, just a current resume from you. And then once we get all that out, I will send that out for review for Dr. Zendel, and she'll get back to me with a decision for your desired start date. And just here's our contact information. So for any program questions, please reach out to Dr. Zendel. Her email is directly on this slide here. If you have any questions about the university, please reach out to the Dean of Health Sciences, Dr. Terry DeVito. She's really nice. She's really easy to talk to, so I'd always recommend reaching out to her. And if you do have any admissions questions about the admissions process or the requirements, please reach out to myself. My phone number and email is on the screen here, and I will be in touch with you about that. And just to kind of finish off now, I do just want to talk a little bit about some frequently asked questions, a little Q&A with Dr. Zendel, and bring her back in on that, and we can just kind of go over some general questions that are asked a lot, so we can go over those. So the first one is, can I switch concentrations once I begin the program?
And that's an easy one. The answer is yes. And we make it quite simple. A few students do this. They'll come in and they'll decide that they want to go a different direction as they start taking their courses. And also as we start meeting and talking. So the way it works is that we would talk because I'm the program director. I also teach, but I'm also the advisor for all the students in the program. So we would talk, take a look at your plan of study or your program schedule, see what we need to tweak, and then you would put in a request to the registrar to change your concentration. And that's it.
And thank you for that. The next one I kind of covered a little bit before, but we'll go over it again. Does my bachelor's degree need to be in a healthcare administration related field?
No, actually, about half of our students, they do not have a healthcare administration undergraduate degree. We have people from all different undergrad fields. We have psychology, business, chemistry, and biology, the hard sciences, which has been really interesting to me. Nursing, even criminal justice. So that doesn't matter. We've even had MDs, medical doctors, come to the program to prepare to move a little bit away from the kind of their clinical duties and into a leadership role. Um, so I would say a lot of our people are clinical, like allied health professions, looking to come into administration and to get those skills. And then we have a lot of people who come, from outside of healthcare entirely.
Yeah, great. Thank you. And I know you had spoken on the asynchronous coursework before, so just kind of what does that look like in the program?
Sure. So, I'll kind of walk through a course because that's such a common question that I get in initial advising, and I often walk through a course with students. So, we have a pretty predictable schedule for our courses. Each week each module is usually 1 week, and they're 8 weeks. Oh, excuse me. So you'll start out with doing some reading, if there's a textbook or some articles or a report, a trending report or something like that. And then we move into a discussion, which is usually asynchronous online discussion. So you might be typing or you might be audio recording yourself. And so there's a back and forth about the topic. Sometimes it's peer feedback. You'll do something. You might do like a case study analysis or talk about interview someone and then bring that into the discussion and then you kind of talk about it. Then from the discussions, we go into an assignment. There'll be one or two assignments, again, depending on the course. So for assignments, there might be team projects, individual projects, case study analyses. Once in a while, we have exams, like for our legal course, we have a couple of exams there. Research papers, oh my gosh, creating training materials, all kinds of things. That would be the assignment. We tend to be project based, as I believe you mentioned earlier, John. So we have students kind of each week walk through a component of a project, culminating at the end with a final project. And that's really the cadence for the courses. You would set your schedule for the courses. So, you might look at your work and, I don't know if you have kids, your kids' schedule and things like that and block in time to do the reading a few times a week to be in the discussion forum, and then when are you going to go to the library and to do your research, and then that sort of thing. So that's kind of the cadence. We also have faculty office hours typically, that you can drop into or set up an appointment with the faculty whenever you want. So that's kind of what our courses look like.
Yeah, thank you for that. It's definitely really nice to know kind of the structure to expect moving forward.
Mhm.
So just kind of moving forward, the next question that I get asked a lot is just, can I begin one of the certificate programs and then decide to do the full master's degree?
Sure. Yep. Definitely you can. We've had a number of students do that who, doing a graduate degree, a master's degree can be intimidating for a lot of people. And it's a financial and emotional and intellectual investment. And so sometimes people do start with a certificate to be sure that they can commit the time. And it's a wise decision too, because if you're taking a certificate, you take those 4 courses and you have something, marketable to help yourself in your career. Then you can decide whether to come into the master's.
Yeah, great. And then finally, is this a good program if I already work in healthcare but want to move into a leadership role?
It's perfect actually for that. And we have a lot of people who do that. Maybe, oh my gosh, probably over half of our students are kind of looking to do that, to move from direct care or clinical into an administrative leadership role. And we work really hard to frame all of our courses, all of our coursework and our assignments so that you can focus on what's important to you, your career goals. So, for example, we have a number of students who come from dental practices. And so they're working in the dental field. They want to be a dental manager or administrator. And so that's the lens that these particular students will go through their courses with, and they'll work on that. Their projects will revolve around that. And they purposefully look at what the skills are that they need to transition into the administrative role. So this program works really well for students, with that goal.
Awesome. All right. Well, that's everything that we have for you. Thank you so much for sticking with us to the end of this presentation. And thank you so much, Dr. Zendel, for giving us all that lovely information throughout the middle of the slides. And as we always like to say here at BayPath, Carpe Diem or seize the day. That's everything I have. Dr. Zendel, you have anything else?
If you have any questions at all, we are very, we're John and I are great to talk to. No pressure. So if you have questions, definitely drop us an email or give us a call. It's wonderful that you are exploring this for yourself. So thank you.
Yeah, definitely. Yeah, we look forward to discussing the program with you. And like I said, on the contact information slide, please feel free to reach out to us via email. We'd love to talk to you about that. But thank you so much and have a great rest of your day for those who are watching.
Thanks. Bye.